Welcome back as we're reflecting in a few moments on the polls you might have seen earlier in the week in the company of Plaid Cymru's Neal McEvoy, who's standing for the Assembly in Cardiff West next May. Now, there were certainly some significant findings in this Welsh Political Barometer poll, particularly with regard to satisfaction ratings for the Welsh Government's performance in the areas of health, schools and the economy. We've seen a decline in how the public think these areas have performed. We've also seen an overall fall in support for Labour ahead of next year's election.
There was also an increase for Plaid Cymru, the Party of Wales, which I'm very pleased with. But I think the key message coming out of that opinion poll is that people are starting to see just how Labour has failed Wales over the last 16 years. If a child is born today into Wales 2015, then the school they will go to, they will have less money spent on them. If they fall ill, they will have to wait longer than any other part of the UK for medical treatment. And on top of that, when they go to work, they will earn less money than anywhere else in the UK. That is the legacy of 16 years of Labour misrule in Wales. And at the same time, of course, they've looked after themselves. I'm speaking to lots of people lately, and it makes me realise, if I didn't already realise, that effectively we don't have an NHS in Wales any longer. I'm speaking to pensioner after pensioner who are having to wait 12 months for eye operations, many of whom are paying up front and having the operations done privately by the same consultants. And that's the same right the way across the board. If you need to see a neurologist, you need to wait 9 months. And these are really serious matters of life and death in some cases. And there are life and death operations which are being cancelled. There was somebody in my ward who has cancer, and they had their operation cancelled 3 times. It's unbelievable.
And obviously it's a political decision. I mean, when it comes down to it, it's how the budgets are allocated. And Labour, some time ago, made the decision which has seen, these changes to the NHS.
Yes, Labour are responsible for cutting the health budget in Wales for the first few years of their administration. On top of that, what they have also done is create a huge bureaucracy. You've got health boards with Labour Party appointees appointed to be chairs of the board. For example, Maria Battle in my area of Cardiff and Vale. There are also management positions. The chief executive of the trust earns, the last figures I read were £205,000 salary. So if you include pension, you're talking £250,000 on one person. I was speaking to a nurse yesterday, and the nurse asked me, what does he do? She knows what she does on the ward. She knows what the doctors do. What does the chief executive do? What do these managers do? What do they contribute? And I'm really glad that Plaid Cymru have some really positive policies in this area, because we want to get rid of the bureaucracy. We want to get rid of the health boards and all their political appointees taking our money, which should be going into medical care. We want free medical care for the elderly, like they have in Scotland, and we want to provide 1,000 extra doctors. So when you fall ill, you don't have to wait 3 or 4 weeks to see a doctor. You can see a doctor within a reasonable amount of time. And also, we've got a really good policy with education in terms of health, because if you want to study medicine, then what we're saying is that you should not pay fees. So if you're a working class kid from areas like Fairwater, Ely, in Cardiff, then go ahead, have the aspiration, have that desire to be a doctor, and you will not be held back financially. I think that's a really, really important thing, because we are importing so many doctors from all around the world, and I'm really glad that we do, because otherwise the hospitals just wouldn't function. But we really do need to be training our own people, and especially our youngsters, and giving them some kind of career trajectory into healthcare.
We're obviously talking about the NHS. What do you feel of the performance of Mark Drakeford?
Mark Drakeford is the AM for Cardiff West. He's the health minister. He's frankly a hopeless constituency AM. He has done virtually nothing about the building on greenfield sites with the local development plan. He's been totally silent on the closure of recycling centres. And in terms of him managing the NHS, being the minister responsible, it's an absolute shambles. And I think it's a reflection of his ability, or lack of ability, as a cabinet minister and as a politician. I understand he's a professor, so if I wanted a lecture in sociology, I'm sure he'd be very good at that. But in terms of performing his role as a minister responsible for health, the experience of real people, of real cases in my constituency tells me that the man has failed and he needs to go. It's time for change in 2016. And I hope the people will support me and will support Plaid Cymru in Cardiff West and right across Wales.
Well, that was Neal McEvoy. Thank you very much to Neal for joining us. Thank you for listening as well, and I hope you can join us again soon.